we are at the end of about an hour and 15-minute long appointment in which we seated this orthotic in your mouth to help open up the back of your throat. So for the last hour and a half we've been doing a lot of adjustments to this appliance, and the orthotic has probably been out of your mouth almost as much as it's been in. So you really haven't had a lot of time to experience this. But let's talk a little bit about some of the symptoms that you were experiencing at the very beginning of this appointment, how you were actually feeling. You mentioned one of the things that you were experiencing just right off the bat, just when you walked in. It was the first thing you mentioned. It was your head is really stuffed up. It's like you've said, a head like a constant sinus infection. And you described it as about a 6.5 out of 10. Has there been any change in how that feels?
Yeah, it actually feels like it's loosening up, less congested. I'd probably give it like a 5 or so out of 10.
Okay.
Now.
Okay. All right. At the beginning of the appointment, you mentioned some tightness in your throat. And you put that on a level of 7 out of 10, with 10 being the worst it could possibly be, 0 being perfect. You described your throat tightness as 7 out of 10. Well, how do you experience that right now?
It actually feels like it's already opening up a little bit, so I'd give that probably a 5 or a 5.5 out of 10.
Okay. You talked about neck pain being a 7 out of 10, and now?
Probably 5.5.
Okay. Shoulder originally was 6 out of 10, now?
Probably 5 out of 10.
Okay. And you also mentioned some tightness in your chest, and you put that about an 8 out of 10.
That's probably been like the best relieved one. That's also like a 5 out of 10.
Okay. Okay.
It feels like I can actually breathe.
Okay. Okay. Is there any other thing that you can articulate and talk about that you find that feels different?
Just feels like I'm getting more air.
Okay.
I can tell I'm getting more air. Things just feel better all around.
Okay. And when you say it feels like I'm getting more air, I think somebody who's never experienced not getting enough air would have a hard time understanding that. Is there any way you can describe that differently so that other people could perhaps understand that?
It just feels like before, it felt like the air wasn't like really circulating anywhere in my body. Like it would just get stuck all up in my head, and I'd have a bunch of pressure in my head, and I can feel the air circulating like all the way from my head like into my shoulders, through my back, and it's like making everything like looser.
Okay.
That's the best way I can really describe it.
Okay.